is. So hear me out on this.
Absolutely, but I want to expand.
That's me.
In this video, he goes over why autism is considered mostly genetic, 81% genetic. And there's a study in JAMA that he goes over. Now, I've seen kids who get vaccines and then they regress and they have autism because of the...
It sounds like you didn't read the article I put up. This is the article from JAMA. It is a review of all of the relevant literature, including 46 publications, over 500,000 children studied. But no, because he personally saw it, it discredits the multiple hundreds of thousands of children that were studied and looked at. Obviously, that sounds wrong.
I'm talking about genetics, that it's literally in your genes, and there are things that can mess up your genes like mutations or other deletions.
The mutations and deletions come from toxins and organisms in a bad diet. The mutations and deletions are the result of the things that mess up your genes.
So no, again, if you had read the article, you would see what's actually causing the deletions and not whatever you just came up with on the spot. There was a study that was done in Nordic countries, so not even in America, that identified specific genes that were genetic variants associated with high risk, or a bunch of common variants that in combination could increase the risk of autism, and that's what happened for the majority of cases. Through a different study using frogs and applying those genes, it appears to be similar in development as during the time a baby or in utero is going through the mid-prenatal prefrontal cortex development. So this is happening when the mom is still pregnant. Hence why if the mother is ill, such as having gestational hypertension or gestational diabetes or a plethora of other conditions, it could express those specific genes, not whatever diet thing, again, that you just made up with on the spot. I mean this in the nicest way possible. I think there needs to be some level of humility where you have to look at your own personal experience and then transpose that over the experience of, again, hundreds of thousands of patients that is seen through tried and true evidence-based research to then come to a conclusion. To just say diet is not conclusive enough, and that doesn't actually help the patients that you think it does. Don't get scammed. Take back your health.